Our first initial response 2 months ago was a little bit of fear. We decided to shut down travel to and from China. These are good ideas when you don't have any facts. We decided to keep people at home and isolate them. Even though everything we've studied about quarantine, typically you quarantine the sick. When someone has measles, you quarantine them. We've never seen where we quarantine the healthy, where you take those without disease and without symptoms and lock them in your home. So some of these things, from what we've studied from immunology and microbiology, aren't really meshing with what we know as people of scientific minds that read this stuff every day. So that's kind of how we started. We don't know what's going on. We see this new virus. How should we respond? So we did that initially. And over the last couple months, we've gained a lot of data. Because when someone dies in this country right now, they're not talking about the high blood pressure, the diabetes, the stroke. They say, did they die from COVID? We've been to hundreds of autopsies. You don't talk about one thing. You talk about comorbidities. Their vessels were narrowed. Their lungs were a smoker. COVID was part of it. It is not the reason they died, folks. It is one of many reasons. So to be so simplistic to say that's a COVID death because they have COVID, you know how many people die with pneumonia or people that die from flu? With flu, I should say. It's not from flu. Their lungs were compromised by COPD. They had a heart attack 2 years ago. They have a weakened body. We aren't pressured to test for flu. But ER doctors now, my friends that I talk to say, it's interesting. When I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID to maybe increase the numbers and make it look a little bit worse than it is? I think so. So this is what I'm hearing from physicians I talked to in Wisconsin, New York, and everywhere.
So initially when this data came out of a new virus that's lethal, they went all out. And I think that was appropriate. But now that we have the data, we're seeing that 97% of patients completely recover. And those 4 patients that die, they have over 90% comorbidities. Let's run through that one more time. Out of 100 people, if 96 do fine, the 4 that die, 90% of those 4 have comorbidities. Heart failure, emphysema, rheumatoid arthritis, lupus. They're on immunomodulating medications. They're immunodeficient, HIV. These are the people that are dying. You get some healthy people that die, but that's an infinitesimal number. Tiny.
How many deaths do they have? 19,410 out of 19 million people, which is a 0.1% chance of dying from COVID in the state of New York. And they have a 92% recovery rate. If you are indeed diagnosed with COVID-19, 92% of you will recover. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death. And the reason I'm making that point is because we're going to compare this to flu and say, is this significantly different from influenza A and B? And if not, why has our response been what it is? The fact that we were able to ramp up and do 4 million is pretty impressive, which gives us a 19.6% positive out of those who were tested for COVID-19. So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. That's a significant amount of people with COVID. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. The deaths in the United States were 43,545, similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home. Some years, it's even as low as 20,000 some year. In 2017, 2018, it was 45 to 50,000, depending on who you read. And we don't necessarily report all of our flu tests. We do thousands of flu tests every year. We don't report every one because the flu is ubiquitous. From what we're seeing right now, it's time to open back up. The science says it is. The models we have been using from predictions to predict the amount of disease are not accurate. This information is accurate. It models the flu. Let's go back to work. That's what the data is saying. Not models. Data is saying that. Look at Italy in 2017. Hospital systems overwhelmed, people dying. Overwhelmed system from the flu. This happens from the flu. If you've been working in the ERs, I've seen multiple people, hallways full, people dying, news media there, stories going on from the flu. This does happen. This does happen.
It's not just the flu. It's the flu. That's what I mean. That's exactly what I mean. People think it's just the flu. It's just coronavirus. What's the difference? You're used to the flu. You're used to saying it's just the flu. FLU, influenza, is something we've grown up with. You're used to it. You're used to it, right? If somebody commits suicide today, you're like, yeah, that person committed suicide. It's awful. Or if somebody dies today from the flu, they died from the flu. It's awful. Terrible. But we're used to it. We're not used to coronavirus. Not used to something brings fear.
You know, and they were screaming for ventilators. What percent of people die on ventilators? 80, 90%? Once you're on a ventilator, if you understand, you're in a bad shape. And they're screaming for 30,000 ventilators that they didn't use, right? They're screaming for a lot of things. 30,000, they used 5. How many 100% over did they order? How many hundreds of millions of dollars? Entire companies, GM, were forced to switch their production lines. For what? I'm saying the secondary causes of what we're seeing oil shut down. We have predictable negatives from lockdown. Predictable negatives. Corona has unpredictable negatives. Talk to ER doctors who have no ulterior motive. They have the same viewpoint. There's a post today from a doctor from Wisconsin. I encourage you all to read it. I'll share his story with you. It is exactly what we're saying. And he eloquently displays, he's an ER doctor. He says, I'm walking into this war zone. Our ICUs are empty. I'm scared to go to my own place of work. There's no patients, but we have people in hazmat suits checking my temperature as I walk through the doors. He's like, something else is going on here. This is not about science, and it's not even about COVID. When they use the word safe, if you listen to the word safe, that's about controlling you. So when I talk to all my ER doctors who work in a hospital, no stake in the game, same opinion. That's how I'll answer your question. We all have the same opinion. At what point, who says what's safe? Are you smart enough to know what's safe for you? Or is the government going to tell you what's safe for you? Who tells you what's... As soon as they use the word safe, that means control. We know what's safe for you. You're too dumb to understand disease, you see. We know what's safe. And so they're going to use this model for different things.
We've actually seen a 75% increase in the news coming from authoritative sources since the beginning of 2020. So we've seen a lot of demand there. But then we also...
What does that mean? That means an increase in video views for those?
Yeah. And so we talk about that as raising authoritative information. But then we also talk about removing information that is problematic. You know, of course, anything that is medically unsubstantiated. So people saying like, take vitamin C, take turmeric, like those are all will cure you. Those are the examples of things that would be a violation of our policy. Anything that would go against World Health Organization recommendations would be a violation of our policy. And so remove is another really important part of our policy.
So you're not just putting the truth next to the lie, you're taking the lie down. That's a pretty aggressive approach.
The first item that I want to point out, and this is critical, is that you can enhance the immune system with convalescent plasma therapy, which is you give immunoglobulins, antibodies made by someone who recovered into someone who's deathly ill. And that seems to jumpstart them. There was a nice article in JAMA, one of our biggest medical journals, showing 4 out of 5 patients did really well with this program. 4 or 5 people who are, these people are all dying basically, and the 5th person is still alive. That's good news. And interestingly, high-dose vitamin C might play a role here, which is one of the reasons we think vitamin C helps to shorten the duration of a common cold. So it's probably worth considering in high doses in New York hospitals and other facilities are testing it, but the jury's still out.
You just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that.